My name is Aita Susi. I used to be a pediatrician, and now I'm a child and adolescent psychiatrist, and I work with families and children in the area of ADHD. So diagnosis. What you need for an accurate diagnosis of ADHD is 6 criteria in 2 different settings. Okay, so school and home, or school and synagogue or church, because they don't want the behaviors to be dependent on the environment that you're in. Some people get nervous and anxious at school and so have all these kind of hyperactivity behaviors going on, but that doesn't come out at home. And this is a biological condition, so we want it to stay consistent over time. Onset. This is an old criteria, onset before age 7. This is a criteria that's the least used, let's put it this way. Plenty of people get diagnosed with ADHD who have a supposed onset at age 9 or 10, or it kind of first gets discovered as a teen or as an adult. But the formal diagnosis says that the onset should be before age 7. And there also should be evidence of problems in daily living. Meaning, if you just kind of drum your fingers like this and are a little bit hyperactive, but you can do your work, you can sustain your relationships, you can go to school, that's not an illness. Okay? It has to actually interfere with your daily tasks, whatever your tasks are. Well, I already talked about the 2 varieties. Many, many, many ways to diagnose. A psychologist can diagnose, a pediatrician, a psychiatrist can diagnose. The key part is that you need someone who's experienced in this, and you need to look at the behavior across different settings. That means you need to make phone calls to school teachers, talk with parents, maybe talk with other family members, and get a sense of this child. Because one person's viewpoint invariably is going to be colored by their personal ideas of how a child, quote unquote, should behave. So you want to get a variety of viewpoints. We do this through interviews. We do this through scales. There are things called Connor scales and Vanderbilt scales where you kind of check off things. And then there's this computerized test called a CPT test where the child sits behind a computer and they have to attend to different tasks. And you see how they perform under stress. And lastly, there is a new form of diagnosis called the NAMI Pa system, Neuropsychiatric EEG-based assessment aid. It's one way of diagnosing ADHD where they actually look at your brain waves, sort of like doing an EEG. And there's a certain relationship between the brain waves that is more common in patients with ADHD. There's no one test to diagnose ADHD. I think that's the take-home message. There's no blood test. There's no one criteria, one thing that you look at. You have to look at a variety of things and get a constellation or a picture. Yeah?
You say you need 6 criteria. What are the criteria?
On my way.
Sorry.
That's okay. There we go. Okay, so for the inattentive aspect, you have 9 options. Difficulties with the details, following through, organization, distractions, remembering things, sustained attention, especially sustained attention for things that are not interesting. Listening, problems with losing things, and problems with boring tasks. You need 6 out of these 9 in order to qualify for a diagnosis of the inattentive form of ADHD. For the hyperactive form, you need also 6 out of these 9s, and these are signs of hyperactivity: fidgeting, climbing, excessive talking, interrupting, on the go all the time, difficulties staying in your seat, difficulties playing quietly, difficulties taking turns, and difficulties blurting out answers. These are the type of kids who just are moving, and they can't stand in line. They're going to butt to the front of the line. They want to play with this for 2 minutes, and then the next toy for 3 minutes. And unless they're totally interested in something, they're just moving from one activity to the next. And they're skinny. Frequently, they're just burning off calories, and they tend to be really, really skinny. Okay, so overdiagnosis is, both overdiagnosis and underdiagnosis actually, are a big concern in ADHD. In cases of overdiagnosis, well-meaning family members and even physicians diagnose normal child behavior as illness. And it's a frequent question in psychiatry and psychology, where's the dividing line between what's on the edges of normal and what becomes illness? And sometimes behavioral problems are diagnosed as illnesses. And a key aspect here to note is that other conditions can look like ADHD. For example, anxiety. When a person gets anxious, they may fidget a lot. They may talk fast. They may not be able to sit still. They may be doing all kinds of behaviors that look like ADHD, but it's not a biological thing that's going on. They're just nervous or anxious about something. And so if you don't look carefully at the whole picture or look at the underlying situation, you may overdiagnose anxiety as ADHD. Taking a look at depression, that can be overdiagnosed as the inattentive form. Okay? You're tired, you don't feel like doing something, you can't focus, you can't concentrate, you lose things, you can't keep track of what's going on. It'd be very easy to, especially depression in children is very difficult to diagnose. It's hard to diagnose in adults too, but most 9-year-olds don't show up and say, "Mommy, I'm feeling sad." Okay, they just kind of either act out, which would be the hyperactive form, or they just kind of get droopy and quiet and can be overdiagnosed as having ADHD. And of course, mania can also look like the hyperactive form of ADHD. Take-home message from this overdiagnosis slide is provider inexperience. You want a provider who works with ADHD and knows to look at all of the aspects. Instead of just saying, "Oh, your kid's hyperactive, must be ADHD." And then the other problem is underdiagnosis. Well, that's just the way they are. They've always been quiet. They always lose things. We go through, 3 winter hats every winter. That's just my son or daughter. But it may or may not actually be an illness. The inattentive form of ADHD is frequently underdiagnosed because it doesn't catch people's attention. When people are daydreaming and looking out the window, nobody notices. And so they don't receive the workup that's necessary. Also, in households that have a certain amount of mental illness, let's say there's a bipolar parent or a sibling with schizophrenia, there can be chaos in the household and other children receive less attention, and so the diagnosis of ADHD or ADD can simply get missed because of all the chaos that's going on. Obviously, shame is a topic that we talk about a lot here at NAMI, that any mental illness can be equated with shame, and so people don't want to go and seek professional help. And I've already talked about provider and experience. Okay, so multiple diagnoses. Understanding this slide, 49%, about half the people with ADHD only have ADHD. But 11% of people with ADHD also are depressed. So they have 2 diagnoses, ADHD and depression. Another 11% of people with ADHD also have an underlying anxiety disorder. And then there's conduct disorder. Conduct disorder is something we don't see very often, fortunately. It's a pretty serious childhood condition where children don't have a sense of empathy for other kids, and they set fires and they hurt animals and do pretty significant damage to the world. This figure seems a little bit high, but according to these folks, 7% of children with ADHD also have some really inappropriate behavioral issues. What's missing from this slide is, it's what's called oppositional defiant disorder. I don't wanna, and I'm not gonna, is your basic description of oppositional defiant disorder. And many, many kids with ADHD also are oppositional or defiant. Mainly the point with ADHD, and I'm going to go into this more in depth in a little bit, is that people with ADHD love doing what they're interested in. They love it. Playing with trains or cooking or sewing, whatever it is that they're interested in, they want to do it. And that's all they want to do. And when you say, please take out the trash, which is really boring, that's when the I don't want us come out and the oppositional behaviors come out.